All right, welcome back. Today, we are digging into something that is absolutely crucial for any surgery, but honestly, it's something most of us never even think about. We're talking about protecting your lungs. This is a huge piece of the puzzle for keeping you safe, not just in the OR, but afterwards too. So, let's say you're getting ready for an operation. What's running through your head? I bet it's a few key things, right? You're probably focused on the stuff you can see and feel. Things like, what's the incision gonna look like? How long am I gonna be off my feet? And of course, how are we gonna handle the pain? And look, those are all totally valid, super important questions. But here's the thing. For your doctors and nurses, one of their biggest priorities is something you might not even have on your radar at all. Your breathing. Yeah, protecting your lungs during and after the surgery. And this whole process, it actually starts way before you even get to the operating room. Okay, so let's talk about what happens when you go under anesthesia. Your body goes through some pretty big changes. While you're completely asleep, your lungs start to act, well, differently. And that creates this hidden but really, really common challenge. Get this, up to 90%, that's 90, of all patients who get general anesthesia have some form of lung collapse. Now, I know that sounds super dramatic, maybe even scary, but it's actually a pretty common thing that your medical team is totally prepared for and knows exactly how to manage. This condition has a name. It's called atelectasis. And the best way to think about it is like this. Imagine your lungs are filled with millions of tiny little balloons. Well, atelectasis is when some of those balloons kind of lose their air and deflate. And when that happens, it makes it harder for your body to get the oxygen it needs. But here's the good news. Preventing this all starts before you even set foot in the hospital. And you are a key player on the team. Seriously, what you do beforehand can make a huge difference in how things go. So your medical team looks at your risk by breaking it down into two main buckets. First, there are patient factors. That's stuff about you, like your age or if you're a smoker. Then there are procedure factors. That's all about the surgery itself, like where it is on your body or how long it's going to take. And to see just how much of an impact this stuff can have, just look at smoking. Smokers have a whopping 73% higher risk of lung complications after surgery. 73%! It's a really powerful example of how the choices you make can directly affect your risk. But this is the most important part. A lot of these risk factors can be changed. You actually have the power to lower your own risk. It's a total game changer to realize that surgery isn't just something that happens to you. How you prepare is a massive part of the whole thing. Okay, so what can you actually do? Well, your team will walk you through it, but some of the big ones are quitting smoking, and doing it at least 4 weeks beforehand makes a huge difference. Also, learning some simple breathing exercises can literally cut your risk of complications by more than half. And of course, making sure any conditions you already have, like asthma or sleep apnea, are under the best possible control. All right, so let's fast forward. We're in the operating room now. While you're totally asleep, there's a whole team of specialists whose job is to actively protect your lungs, and they've got a whole toolkit of techniques to do it. Even the type of anesthesia can make a difference. Sometimes, for certain surgeries, it's possible to use what's called regional or local anesthesia. That's where they just numb a part of your body instead of putting you all the way under. And in some cases, that can actually lead to fewer lung issues. It's a conversation you'll have with your anesthesiologist, for sure. So what's in that anesthesiologist's toolkit I mentioned? Well, they use something called lung protective ventilation. Basically, using smaller, gentler breaths from the machine to be kind to your lungs. They also use a little bit of gentle pressure, called PEEP, to help keep those tiny air sacs, those little balloons, from collapsing. And on top of that, they're super careful about managing IV fluids and making sure all the muscle relaxants are completely worn off by the end. It's a whole strategy. Okay, surgery's done. Now the focus shifts right back to you. And those first 48 hours, they are absolutely critical for getting your lungs back in shape and heading off any potential problems. A lot of hospitals use this really simple but incredibly powerful program to help with recovery. A common one has this easy-to-remember name, ICOF. And it's basically a checklist of all the key things you need to do, like using a special breathing gadget, coughing and deep breathing on purpose, and getting out of bed and walking around. All of these things are proven to help your lungs. And does it work? Oh yeah, the results are incredible. A major study showed that programs just like this one can dramatically slash the rates of serious lung complications like pneumonia. It just goes to show you, when the hospital staff and the patient are all working together from the same playbook, it makes a huge difference.
Now look, even when everyone does everything right, complications can still happen sometimes. It's just a reality of surgery. But the most important thing to know is not to panic. Your team is prepared for this. They are ready for anything.
The one we see most often is postoperative pneumonia. It's basically an infection that sets up in your lung tissue. And it's a risk because after surgery, pain can make you take really shallow breaths. And that's the perfect environment for an infection to take hold. There's a much rarer but more serious condition called ARDS. That stands for Acute Respiratory Distress Syndrome. This is when the lungs get really inflamed all over, making it very, very hard to breathe. But here is the critical takeaway. If, and that's a big if, any of these issues pop up, there is an entire arsenal of advanced support ready to go at a moment's notice. We're talking high-flow oxygen, special breathing masks, advanced ventilators, and 24/7 monitoring in the ICU. Your team has got your back. So you can see, this whole journey really is a partnership. It's you and your medical team working together, all focused on exactly the same goal, getting you through this safely and getting you back on your feet as quickly as possible. So what's the one thing I really want you to take away from all this? It's that your role in this is huge. Your preparation and your participation, those are your superpowers. By being informed and being an active player in your own care, you become the single most important factor for a safer surgery.